Hello, everyone. I'm Governor John Carney. Thank you for joining us today. I'm here to kick off Breast Cancer Awareness Month, and I have a proclamation that I'm going to sign in a minute. On the screen with me virtually are members of the Delaware Breast Cancer Coalition. We appreciate the tremendous work that they do, bringing awareness to the scourge for women and men in our state. For many years ago, I served on the Delaware Cancer Consortium, and one of the focuses that we had 20 years ago was to make sure that women in our state in particular had access to screenings to identify breast cancer early on so that it can be treated successfully. We at that time initiated, and a little bit before that, the Screening for Life program, and it has literally saved the lives of so many women across our state. We have so many breast cancer survivors who are here to tell their own individual stories, still here and alive, because they took advantage of opportunities to get the life-saving screenings. The Delaware Breast Cancer Coalition has done an incredible job bringing awareness to the need for screenings, bringing awareness to the scourge of breast cancer among women and men in our state, and advocating for public policy to help us address this terrible problem. It is the cancer that is most prevalent among women, representing about 30% of the cancers that women experience. So we declare October each year as Breast Cancer Awareness Month. It's an opportunity again to get the word out to women and men across our state to make sure that they take advantage of opportunities to get screened, opportunities to get appropriate treatment, that we have the kind of response to those who sadly have to experience tremendous pain and loss from breast cancer, and the Delaware Breast Cancer Coalition. The women on the screen with me doing an unbelievable job with that, and it's my privilege as governor today to read part of this proclamation, to sign it. We also have other testimonials that you'll hear. But now we'll turn it over to Francesca, who's the executive director there of the Delaware Breast Cancer Coalition. We thank you for your great work and look forward to your words.
Good afternoon, and thank you, Governor Carney. Thank you for acknowledging the Delaware Breast Cancer Coalition on this October day as we set course for a very productive agenda of outreach, education, and breast health awareness throughout the state this month. From a global perspective, female breast cancer is now the most commonly diagnosed cancer, overtaking even lung cancer for the first time, as reported by the American Cancer Society. Closer to home in Delaware this year alone, there are expected to be 990 new breast cancer diagnoses and 160 breast cancer-related deaths. Sadly, these numbers have both increased since last year and underscore the importance of our continued partnership with the state in ensuring Delawareans receive our life-saving messaging, recognize the increased risks of breast cancer, and proactively seek screenings, utilize the resources available to them through the DBCC and the state. At DBCC, we believe every day is Breast Cancer Awareness Day. And while we have much work ahead of us, we do want to pause to acknowledge the important work DBCC has accomplished in this past fiscal year. DBCC assisted 966 women with navigation and coordinated 633 mammographies through the Women's Health Screening Program. DBCC provided 351 women with interpretation and 92 with transportation to their screenings. DBCC held 302 survivor programs and activities serving 3,344 breast cancer survivors. This included educational classes for those newly diagnosed, ongoing self-support programs, a holistic conference, Nurture with Nature activities, and a variety of in-person and virtual networking and educational programs. DBCC presented peer mentor trainings, adding 17 new peer mentors to the 301 active peer mentors who provide one-to-one emotional support, resources, and research-based information to 142 newly diagnosed women. And in this last fiscal year, the survivorship team expanded Yes to Health, a 12-week walking and nutrition education program delivered virtually through the pandemic offering 124 classes throughout the state with 784 participants. DBCC reached over 880 people through community events and breast health presentations. DBCC staff includes 5 Spanish-speaking individuals and 1 member fluent in Haitian Creole, making DBCC a trilingual organization. And through the Breast Care Fund, DBCC provided over $59,000 in assistance to women diagnosed with breast cancer, providing emergency funding for basic life needs. Thank you once again for this acknowledgement today. We look forward to working with the state in ensuring proactive measures are taken to improve health outcomes for all Delawareans. As the DBCC celebrates 30 years of public health service in 2021, we greatly appreciate our partnership. Working with the state and collaboratively with other statewide organizations to advance our life-saving work and mission, we are surely a formidable force in the fight against breast cancer. Thank you.
Thank you, Francesca. Indeed, you are a formidable force. Thank you for enumerating so many of the things that the Breast Cancer Coalition does, saving the lives of many Delawareans. Thank you to the survivors for their volunteer efforts and for the strength that they bring to your outreach and to your programming. It's just incredibly important as we address this challenge for women and men across our state. And now it's my privilege as governor to declare October as Breast Cancer Awareness Month in the state of Delaware. I do have a proclamation, which I'd like to read, which says, whereas breast cancer has unfortunately impacted many individuals and families throughout Delaware and across our nation, and whereas breast cancer is the most commonly diagnosed cancer among females in the U.S. and in Delaware, with over 4,000 female breast cancer cases, which is 30% of all female cancers diagnosed in Delaware from 2012 to 2016. And whereas each October, we remind women to get recommended mammograms and exams and to perform monthly self-exams because early detection is essential to treatment and recovery. And whereas Male Breast Cancer Awareness Week, observed October 17th through 23rd, reminds us that the disease can affect anyone, and men are encouraged to talk to their doctor if they notice something suspicious. And whereas numerous local and national organizations work tirelessly to connect individuals with breast cancer screening and treatment services, and whereas this year thousands of people have received screenings and have visited various outreach events, health fairs, and breast health presentations in Delaware, so many of them coordinated through the Delaware Breast Cancer Coalition. And whereas importantly, we recognize survivors for their incredible strength, we stand with those currently fighting, and we honor the memory of those who have lost their battle with breast cancer. Now, therefore, we, John Carney, Governor, and Bethany Hall Long, Lieutenant Governor, do hereby declare October 2021 as Breast Cancer Awareness Month in the state of Delaware. And we urge all Delawareans to raise awareness of breast cancer, support our fighters and survivors, get yearly screenings, and then visit healthydelaware.org for additional resources. The Lieutenant Governor has already signed it. And now, so have I. And so we've proclaimed October Breast Cancer Awareness Month in the state of Delaware. Again, we thank the coalition for their tremendous work. We will have other video messages from Delaware leaders. We thank you all for tuning in today.
Hi, Lieutenant Governor Bethany Hall Long. As a nurse and co-chair of the Cancer Education Committee of the Cancer Consortium of Delaware, I am honored to join our Governor Carney as we put forth the proclamation for Breast Cancer Awareness Month. Far too many men and women receive a late diagnosis. We hope that you are taking advantage here in Delaware of our screening programs and our education programs so that we can lower the number. Right now, 1/3 of all cancers in our state among females, highest portion comes from breast cancer. So let's join together, wear our pink this month, raise awareness that individuals can get free mammograms should they not have insurance or be underinsured, so that we can lower this number. So thank you to the many organizations and to coalitions and entities that are really standing up with runs and walks and outreach. And let's make sure that not only during October when we have our pink on, but year round, we integrate services, we educate others, and we share information. I encourage you to dial our public health numbers to get your free screening should you need a mammogram, or to call 211, which can provide you with a whole menu of services. So to the men and women this month, let's be well, let's be safe, practice good screening, good habits, and we hope that next year our numbers will decrease with the number of women with breast cancer.
Hi, my name is State Senator Tizzy Lockman, and I'm proud to be part of this virtual proclamation signing recognizing October as Breast Cancer Awareness Month. Events like these are so great because we not only recognize the many Delawareans who have battled breast cancer, but we also encourage our neighbors to be proactive about the importance of screening and early detection. That's especially important for Black women, who in Delaware are more likely to be diagnosed with breast cancer at a younger age and have a higher breast cancer mortality rate. We know that when breast cancer is detected early, there's a much higher rate of survival. I want to stress the importance of conducting monthly self-exams and scheduling routine clinical breast exams and mammograms. I also want to thank the Delaware Breast Cancer Coalition for the crucial work they do to promote early detection and treatment of breast cancer. And thank you to the many healthcare professionals working tirelessly in the middle of a global pandemic to make sure women still have access to life-saving treatment. Thank you.
Almost everyone has a personal story about how breast cancer has impacted their or their family's lives. That's why it's so important that we take the time to raise awareness of this horrible disease, which is the most common cancer among American women. Breast Cancer Awareness Month is also a time to support survivors and to work to increase access to the needed services and therapies. In the General Assembly, there have been various efforts to remove barriers to treatment, and I was honored to champion one particular initiative, HB 120. This bill removed insurance barriers so that those with metastatic cancer can get better access to innovative therapies. I pledged to continue to stand shoulder to shoulder with advocates, survivors, and caregivers in the fight against breast cancer. And I hope all of you will join me supporting the local fundraising and outreach efforts happening throughout Delaware this month.
I'm Molly McGarrick, Secretary of the Department of Health and Social Services. I joined Governor Carney today in his message about the importance of raising awareness about breast cancer and encouraging early screenings. Thanks to early detection from screenings and improved treatments, there are more than 3.3 million people in this country who are breast cancer survivors. The most effective screening test to detect breast cancer remains the mammogram. Annual mammograms for women over 40 can help catch many breast cancers in their early and most treatable forms. If you are uninsured or underinsured, you may be eligible for a free or reduced cost breast cancer screening through the Division of Public Health's Screening for Life program. To schedule your appointment, call the Delaware Breast Cancer Coalition at 1-888-672-9647. You have the power to save your own life.